The Centers for Disease Control and Prevention reports more than 24 million people here in the U.S. have pollen-induced respiratory allergies like hay fever. And experts predict that this year's allergy season will be a tough one. So joining me today is SSM Health family medicine physician and wellness coach, Dr. Rupa Shah, to talk about this year's seasonal allergy, something on the minds of a lot of folks out there. So what is causing the earlier start of allergy season?
So, climate change is really leading to this increased kind of and longer allergy season that we're having, right? The warm February we had, right, also kind of it leads to this where things are starting earlier, they're lasting longer, we're seeing higher tree, grass, weed, pollen counts, and again, happening earlier and longer, so people really need to kind of gear up for the allergy season this year.
So really an extended season.
Yes, unfortunately.
Now, why does pollen cause allergies? Kind of break that down for us.
Yeah, so pollen is how all these plants kind of fertilize each other, right? But it's that particulate matter that kind of floats through the air that we can't really see.
Right.
But those of us that have allergies, myself included, when we inhale it, our body sees that as a foreign substance that it has to fight. So we secrete all these antibodies, and in that process, we secrete a lot of histamine. So this is what causes the runny nose, itchy eyes, the postnasal drip, even hives sometimes. So it's really just this exaggerated immune response that we're getting.
Kind of fighting them off. Now, how can people help manage their allergies? What are some good tips you have?
So I mean, clearly, common things that people can do: keep your windows closed during that time if you're really sensitive. Check those air filters on your HVAC system. Try and avoid early morning, late afternoon when that pollen is really high. But also make sure you're stocking up on your allergy meds. You're getting your antihistamines, getting in with your allergist. Also, if you think you might even be a candidate for allergy shots if your symptoms are getting much worse.
So some things you can do just, mindfully in the morning or stuff like that, but also medication.
Correct. Got to kind of use that double-pronged approach there for people.
Sounds good. Dr. Shah, where else can people find you?
So they can find me on Instagram at Wellness with Dr. Shah.
All right. Thank you as always.
Thank you.